Assalamu alaikum wa rahmatullahi wa barakatuh. Dear students, we are going to study today the hemostasis, the mechanisms of hemostasis. So, we have to understand what is the mechanism produced by the blood and the blood vessels to stop bleeding from injured vessel. Here we have the objectives of our lectures. Platelets or thrombocytes. Platelets are derived from megakaryocyte. This is the mother cell of the platelets and usually in the red bone marrow, which is located in the flat bones. It gives us about 2000 to 3000 platelets. These 2000 or 3000 platelets are derived from one megakaryocyte. They leave the red bone marrow, enter the peripheral circulation. They appear as a piece of the cell membrane and containing different vesicles but no nucleus. So each fragment or each platelet enclosed by a piece of the plasma membrane, and these platelets leave the red bone marrow and enter the circulation, and as you will know they have no nucleus like the red blood cells. Platelets are more numerous than white blood cells. Their count is present in hundreds of thousands, 150,000 to 400,000 cell per microliter. They have a short lifespan, 5 to 9 days. They don't have much mass. They appear as a little specks interspersed among many red blood cells. If you have looking to this blood film, and that is the red blood cells, this is white blood cells, and if you look here, it is present in between the white, between the red blood cells. Their granules contain chemicals that once released promote blood clotting. As we mentioned, it is contain different granules, and when these granules are releasing the chemicals inside, they are going to activate the process of blood clotting. We have a hormone called thrombobiotine hormone. This hormone produced by the liver, and it stimulates the production of megakaryocytes in the bone marrow. Stimulates the production of megakaryocytes in the bone marrow. Hemostasis. Hemostasis is defined as a group of mechanisms produced by the blood and the blood vessel to stop bleeding. So, the sequence of response that stops bleeding. Again, we can define hemostasis as the mechanisms produced to stop bleeding by the blood vessel and the blood itself. We have mainly three mechanisms reduce blood loss. These three mechanisms include number one, the local vascular spasm. Local vascular spasm that produce what? Vasoconstriction of the injured blood vessels. Vasoconstriction of the injured blood vessels. That is the blood vessel. And after the injury, there is local vascular spasm produced by the contraction of the smooth muscles in the wall of the blood vessel. That is produced to what? To reduce bleeding. To reduce bleeding. Also, it slows the blood flow, allowing the platelets to come in contact together and in come in contact with the subendothelial collagen. So the local vascular spasm slows the blood flow, and when it slows the blood flow, it brings the platelets in contact together. Also, it brings the platelets in contact with the subendothelial collagen. The second mechanism is the platelet plug formation. Platelet plug formation. Here we have a mass of the platelets coming together to close the site of injury. That is the mechanism of platelet plug formation. Platelets stick together and sticks also to the wall of the damaged blood vessel, become activated and accumulated in large number, forming a clump to stop bleeding. But this clump or this plug is loose, can be easily removed. So the third mechanism, which is the blood clotting or the coagulation, the interaction of the clotting factors forming the fibrin threads. These fibrin threads are going to produce what? Stiffness of the platelet plug and producing a blood coagulation. So complex cascade of enzymatic reaction to produce clot formation. Normally, the clotting factors are circulating in inactive state, while when there is injury or there is release of the chemicals from the platelets, we have enzymatic activation of these clotting factors to produce their activation and the formation. Platelet plug formation. The mechanism of platelet plug formation needs the following steps. Number one, platelet adhesion. The first step in platelet plug formation is platelet adhesion to the subendothelial collagen. So once there is injury of the wall of the blood vessel and exposure of the subendothelial collagen, the platelets become and attach themselves to the subendothelial collagen, and this usually needs a factor called von Willebrand factor. This usually needs a factor known as von Willebrand factor. The second process is, or the second step is the platelet release reaction or platelet activation. Platelet release reaction or platelet aggregation. The platelet change their shape. They form finger-like processes to interact together. Also, the platelet start to release the contents of their granules. Release the content of these granules, which is located inside. So we have increase in the release of ADP, serotonin, and thromboxane A2. So we have release of serotonin and thromboxane A2. This produce vasoconstriction of the blood vessels, decreasing the blood flow, decreasing the blood loss, and we have release of ADP and thromboxane A2, which produce activation of nearby platelets. These factors, especially thromboxane A2, is going to produce activation of the nearby what platelets. It will produce something which is called platelet aggregation. Platelet aggregation. The meaning of platelet aggregation, it acts like a chemotactic factor, moving the platelet towards the site of the injury, moving the platelet toward the site of injury. The last step, which is the platelet aggregation and the plug formation. Platelet aggregation and plug formation, what is going? We have here mass of platelets comes and clump it together. Why? Because there is something like a positive feedback mechanism. Once the platelet become attached or adhere to the subendothelial collagen, become activated, releasing the contents of their granules, bringing more platelets, activation, adhesion, and release of the contents. So we form a mass of platelets. We recruit more platelets, and these platelets are going to form the platelet plug, forming the platelet plug. So that is the platelet plug formation. It starts with platelet adhesion, platelet activation or platelet release reaction, and lastly the formation of platelet plug by the platelet aggregation. The third step in the process of hemostasis is blood clotting. What is the mechanism of clotting? What are the clotting factors interacting? What are the sources of the clotting factor? That is, we are going to answer the following questions. So, the first question, what is the mechanism of the blood clotting? The mechanism of blood clotting is a series of a chemical reaction that lead to the formation of the fibrin threads. Normally, under normal physiological condition, when there is no blood loss or there is no injury, there is no fibrin threads in your blood. While if there is injury and activation of the enzymatic reactions, the clotting factors are going to interact together in order to form the fibrin threads. So, what is the definition of the blood clotting? It is a series of a chemical reaction that lead to formation of fibrin threads. What is needed? It usually involves several factors called clotting factors. So, in order to form the fibrin threads, we need the interaction of several clotting factors. What are these clotting factors? These clotting factors include calcium and several inactive enzymes, synthesized mainly by hepatocytes. Okay, various molecules comes from platelets or released from the damaged tissues. So what are the sources of the clotting factors? Usually coming from the hepatocytes, from the platelets, or from damaged tissues. Plus what? Plus calcium. Calcium is essential in the process of blood clotting. Without calcium, no clotting. Most clotting factors are indicated by Roman numbers. and this indicates the order of their discovery. Clotting is a complex cascade of enzymatic reaction in which each clotting factor activates many molecules of the next reaction in a fixed sequence. So we have a fixed sequence, and this fixed sequence needs interaction of the different clotting factors by enzymatic reaction in order to form at the end fibrin threads. So blood clotting needs clotting factors. Most of the clotting factors coming from hepatocytes, from platelets, from the damaged tissues, and we need calcium, which is usually the clotting factor number 4, and the clotting factors are indicated in Roman number. And as we mentioned, it needs a complex cascade of enzymatic reaction in order to form the activation or the sequence of activation of the clotting factor, as we are going to see. We have here the different clotting factors. Number one, fibrinogen coming from the liver. And here we will find which pathway it is present in. It is present in the common pathway. Prothrombin, it is factor 2 coming also from the liver, present in the common pathway. Tissue factor, thromboplastin, coming from the damaged tissues and activated platelets. Calcium ion, it is a factor 4, present in all pathways. Factor 5, proacceleratin or labile factor. Factor 7, serum prothrombin or stable factor. Factor 8, antihemophilic globulin or antihemophilic factor. Factor 9, Christmas factor or antihemophilic factor B. Factor 9, Christmas or antihemophilic factor B. Factor 10, Stewart-Brower factor or thrombokinase. Factor 11, plasma thromboplastin antecedent, antihemophilic factor C. Factor 12, Higman factor or glass factor or contact factor or antihemophilic factor D. It is also coming from the liver. Factor 13, fibrin stabilizing factor. There is no factor 6. Prothrombinase or prothrombin activator is a combination of factor 5 and factor 10. So if we look to the source, most of the clotting factor are derived from where? Derived from the liver, and some from the platelets, and only factor 3 is coming from the damaged tissues. And we find here which pathway the factor is present in. Stages of clotting. We have the 3 stages of clotting. If we look here, the first stage is the formation of the prothrombinase. That is the first step in the blood clotting, the formation of prothrombinase. And the formation of prothrombinase needs the interaction of different clotting factors, either through an extrinsic pathway or the intrinsic pathway. The second process, or the second step in the process of clotting, is the conversion of prothrombin into thrombin, and this usually needs the prothrombinase. So prothrombinase is needed to convert prothrombin into thrombin. And the last stage is the activation of the fibrinogen into the fibrin threads, formation of the fibrin threads from fibrinogen. So that is the 3 steps of the process of blood clotting. Number 1, activation or formation of prothrombinase. Number 2, conversion of prothrombin into thrombin. Number 3, conversion of fibrinogen into fibrin. So let us go and read the slide. 2 pathways called the extrinsic or the intrinsic pathways that lead to the formation of prothrombin activator or prothrombinase. Then prothrombinase convert the prothrombin into thrombin, and thrombin converts fibrinogen into the fibrin, and these fibrin threads are going to interact together, attach together side to side and end to end to form the clot. Stage 1 of clotting, which is the formation of prothrombinase by the extrinsic pathway. The extrinsic pathway is dependent on the release of a tissue factor from the damaged tissues. From the damaged tissues, we have released tissue factor, which is factor number 3. This tissue factor is a complex mixture of lipoproteins and phospholipid that is released from the surface of the damaged cells. So it is a complex mixture of lipoproteins and phospholipids. In the presence of calcium, in the presence of calcium, tissue factor begins a sequence of reaction that produce what activation of factor 10. So tissue factor with calcium will produce activation of factor 10. Factor 10 active plus factor 5 active in the presence of calcium will form prothrombinase. So activator factor 10 combines with factor 5 in the presence of calcium will form the prothrombinase, completing the extrinsic pathway. So the first step in the extrinsic pathway in order to form the prothrombinase is the interaction between the tissue factor with calcium activating factor 10, active factor 10 with active factor 5 in the presence of calcium form prothrombinase. Now we are going to look for the formation of the prothrombinase by the intrinsic pathway. It is more complex pathway. It needs the interaction of different clotting factors. It dependent on the release of factor 12. Factor 12. So it is more complex and occurs slower than the extrinsic pathway. The activator of the pathway are either the direct contact with the blood with the subendothelial collagen. Okay, so when the blood comes in contact with the subendothelial collagen, there is activation of factor 12 release, and the contact of the blood with the collagen present in the wall of the blood vessels will produce activation of factor 12. So, if endothelial cells become roughened or damaged, blood comes in direct contact with the collagen fibers of the blood vessels and the platelets become damaged. This activates the factor 12, which eventually activates factor 10. So, factor 12 activated when the blood come in contact with the collagen present in the wall of the blood vessels. So with calcium it's going to activate what? Activate factor 10. This usually needs the platelet phospholipids. This usually needs platelet phospholipid coming from the activated platelets. Activator activated factor 10 with factor 5 and calcium will form the prothrombinase. Activator activated factor 10 with factor 5 active with calcium will form prothrombinase. Stage 2 of clotting, which is the formation of thrombin. Prothrombinase will convert the prothrombin into thrombin. Prothrombin is inactive. With the presence of prothrombinase and the calcium, it will be converted into thrombin. So we have here formation of the thrombin. Thrombin is acting as an enzyme producing activation of most of the clotting factors. Most of the clotting factors are activated by thrombin. So thrombin is going to activate the factor 12, activates factor 10, activates factor 5, activates most of the clotting factors present in the extrinsic and intrinsic pathway. And we have here a positive feedback mechanism, means that thrombin is going to activate most of the clotting factor, increasing the formation of prothrombinase. This will increase the formation of thrombin. So thrombin is working to activate most of the clotting factors in the extrinsic and intrinsic pathway, and also it will work in the third step, which is the conversion of fibrinogen into fibrin threads. So in stage 3 we have thrombin, and thrombin is going to produce what? Conversion of the fibrinogen into the fibrin threads, and this step needs the presence of calcium, Thrombin also activates factor 13, which is known as fibrin stabilizing factor. Fibrin stabilizing factor. And when it interacts with the fibrin stabilizing factor, it's going to form bonds between the fibrin threads. It's going to form bonds between the fibrin threads. And when this occurs, there is stabilization of the fibrin clot. There is stabilization of the blood clot. Plasma contains some factor 13, which is also released by the platelets trapped in the clot. So, what is the source of the factor 13? Factor 13 is present in the plasma, and some of the factor 13 is coming from the platelets, which is present in between the clot, which is present in between the clot. Clot retraction and repair. The process of clot retraction means the strengthening or the tightening or the consolidation of the fibrin clot. This means that the fibrin clot will become more stabilized, more strong to avoid the damage or to avoid the bleeding. So this usually needs the platelets which have the capacity to contract and approximate the fibrin threads together, approximate the edges of the damaged vessel together to repair the damage. During retraction, some serum escape in between the fibrin threads. This serum is a plasma without clotting factors. This serum is plasma without clotting factors. Normal retraction depends on the platelet and the release of factor 13 from the platelets that produce strengthening and stabilizing the clot. As the clot retracts, we have fibroblasts stimulated by platelet-derived growth factors rebuild the vessel wall. So we have growth factors coming from the platelet, and this growth factor stimulates the fibroblasts to rebuild the vessel wall, while new endothelial cells stimulated by vascular endothelial growth factor repair the vessel lining. So we have here the process of healing of the vessel wall, healing or repair of the vessel wall. Role of vitamin K in clotting. Normal clotting depends on adequate level of vitamin K in the body. Vitamin K is not directly involved in the actual clot formation. We don't have vitamin K in the process of blood clotting, but vitamin K is needed for the formation. The liver cells or the hepatocytes needs vitamin K for the synthesis of four clotting factors 2, 7, 9, and 10. So the role of vitamin K is what is helping or essential for the formation of the clotting factor 2, 7, 9, and 10. It is normally present in diet and also produced by the bacteria flora present in the intestine. It is present in diet and also it is derived from what? Derived from the bacteria flora living in the intestine. It is a fat soluble vitamin, so it can be absorbed from the intestine. And as you studied in the gastrointestinal, the fat soluble vitamins or the vitamins A, D, E, and K needs bile for their absorption. Fibrinolysis or dissolution of the clot. Clotting is not meant as a permanent solution after vessel injury. Clots are dissolved once the damage is repaired. This is done by the fibrinolytic system. So we have a system called fibrinolytic system. This fibrinolytic system is dependent on a certain type of protein called what? Called the plasminogen. Called the plasminogen. So many times a day, little clots begin to form. A small clot has a potential to enlarge and impair blood flow through the undamaged vessel. So it is important to have a mechanism that dissolves the small inappropriate clots. The solution of the clot is called as fibrinolysis. So the process of fibrinolysis means the ability to produce what? To produce removal of the unwanted clots, the solution of the unwanted clots, and this usually occur by the protein called what? Plasminogen. Plasminogen is inactive protein, should be activated to plasmin, and this usually needs a tissue plasminogen activator released from the endothelial cells. Released from the endothelial cells. So tissue plasminogen activator, thrombin, and activated factor 12 stimulates the conversion of the plasminogen into what? Into plasmin. And the plasmin is acting as enzyme that digest the fibrin fibers. Digest the fibrin fibers. Fibrinolysis begins within 2 days and continues slowly over several days until the clot is dissolved. Fibrinolysis begins within 2 days and continues slowly over several days till the Normal anticoagulants limit a clot extension. Normal anticoagulant limit clot extension. Clot formation normally remain localized at the site of the damage for the following reasons. We can put another title for this slides, which is the factor that prevent intravascular clottings, or what are the factors that prevent intravascular clotting, or what are the factors that keep your blood in a fluid state. So we have group of factors that's known as a normal anticoagulant that limit the clot extension or that prevent the intravascular clotting, keeping your blood in a fluid state. This is including number one, fibrin fibers. Fibrin act as an anticoagulant. The fibrin fibers that form the blood clot is also acting as anticoagulant by binding thrombin, preventing the thrombin from activating or spreading into the circulation and activating multiple clotting factors. So, number one, fibrin attached to or adhere thrombin to its wall, preventing or bind to thrombin, preventing the thrombin from escaping into the circulation and activating different clotting factors. Prostacyclin. Prostacyclin is a type of prostaglandin produced by the endothelial cells and white blood cells oppose the action of thromboxane A2. Oppose the action of thromboxane A2 and is a powerful inhibitor of platelet adhesion. A powerful inhibitor of platelet adhesion. Antithrombin. Antithrombin, glycoprotein present in the plasma and produced by the liver, bind to thrombin. Antithrombin, it is a glycoprotein coming from the liver. It binds with thrombin, and this antithrombin is usually activated by a factor called heparin. So it binds with thrombin, preventing it from activating the different clotting factor. And it also inactivates factor 10 and factor 12. Heparin is a powerful natural anticoagulant found in the granules of mast cells and basophil. It activates the antithrombin. It activates antithrombin and increase its effectiveness. It increase its effectiveness. Activated protein C, plasma protein synthesized in the liver, and it inactivates factor 5 and factor 8, sorry. It inactivates factor 5 and factor 8. So these are the factors that prevent what? Prevent the intravascular clotting. These are the factors that keep your blood in the fluid state. Fibrin fibers. Fibrin, when formed, it bind to thrombin, preventing its spread in the circulation and activating different clotting factors, preventing the formation of multiple blood clots. Prostacyclin prevent the platelet adhesion to the healthy endothelium. Antithrombin bind with the thrombin and inactivates factor 10 and factor 12. Heparin activates antithrombin, increasing its effectiveness. Activated protein C, and usually this produces inactivation of factor 5 and factor 8. Inactivates factor 5 and factor 8. Intravascular clotting. Clotting in unbroken blood vessel is called what? Is called thrombosis. This thrombosis usually occurs due to roughness of the endothelial surface occurring in atherosclerosis, occurring with trauma, occurring with infection, like that is present nowadays in coronavirus infection or in some patients with COVID-19 infection. What has happened in them? They have formation of thrombi in their blood vessels. Why? Because they developed that or they researched about the COVID-19 or the coronavirus. It is an endothelial virus. It affects the endothelial cells, producing damage of the endothelial cells, activating the platelets at the site of the injury, and this will produce what? Activation of the clotting pathway, formation of clots. So usually nowadays or in these days they are going to treat the subject with COVID-19 with anticoagulants to prevent what? To prevent the blood clotting. Also, intravascular clotting can occur with prolonged bedridden or prolonged slow blood flow. and this usually occur with stasis or with the slow blood flow if someone is going to stay in the bed for a long time, and it's usually one of the mechanisms that produce also thrombosis. Thrombus is what? It's a clot that develops and persists in unbroken blood vessel. So the thrombus is clot that develops and persists in unbroken blood vessels. And it may be what? It may block the circulation, leading to tissue death. It will produce stagnant hypoxia. It will produce stagnant hypoxia or ischemic hypoxia, decrease oxygen delivery to the tissues, decrease the ability to produce energy. So usually there is tissue death. Dislodge and become an embolus. It become dislodged from the site of formation and become an embolus. Embolus means it's a moving thrombus. It is a circulating in the blood, and this embolus can go and block any vessel anyway in the body. Embolus could be a blood clot or air or fat or a piece of debris that is freely floating in the bloodstream. So the embolus, which is circulating inside the bloodstream, could be a blood clot, part of a thrombus that dislodge, or air, fat, or a piece of debris that's freely floating in the bloodstream. For example, the pulmonary emboli impair the ability of the blood to obtain oxygen. The pulmonary emboli impair the ability of the body to obtain oxygen. But how can this pulmonary emboli develop? This pulmonary emboli usually developed from something called deep vein thrombosis. Deep vein thrombosis. What's the meaning of a deep vein thrombosis? If we have someone undergo after surgical operation stayed in the bed for a long time with prolonged stasis of the blood in the lower limbs after prolonged bed staying in the bed, prolonged duration of staying in the bed, there is a slow blood flow, and this slow blood flow will allow the blood to produce clotting in the deep veins of the leg, and this thrombus formed in the deep vein in the leg is going to be what? Dislodged and moving from the deep veins of the leg to the what? To the veins like the femoral vein, going to the iliac veins, going to the inferior vena cava. From the inferior vena cava go to the liver. From the liver going to what? Going to the heart. And from the heart is going to where? From the right atrium to the right ventricle to the lung. And it become dislodged or become trapped, where? Trapped in the pulmonary capillaries, trapped in the pulmonary capillaries, and when it is trapped in the pulmonary capillaries, it will form a pulmonary emboli, and this will interfere with the process of ventilation and perfusion. Ventilation and perfusion, decreasing the ability of the body to get oxygen. It may cause cerebral emboli that cause stroke. It may move from the pulmonary, going to the left side of the heart, and then passing to the cerebral blood vessels, causing stroke. Prevention of undesirable clots. How can we clinically prevent undesirable clots? What are the drugs used to prevent the formation of blood clots? Number one, we have aspirin. Aspirin is an antiprostaglandin that inhibits the formation of thromboxane A2, so inhibit vasoconstriction and platelet adhesion. So it is used usually in a small dose to decrease the formation of thromboxane A2. Heparin, it is an anticoagulant taken by injection, and it is going to activate the antithrombin 3, and when we activate the antithrombin 3, we are going also to produce binding with the thrombin, and also it will decrease the activity of factor 10 and factor 12. It is used clinically for pre and post operative cardiac care. If someone developed uh, ischemic heart attack, you actually giving them heparin to dissolve the clot and prevent the formation of multiple clots. Warfarin, it is a drug taken orally, acts as antagonist to vitamin K. It prevents the liver from using vitamin K and preventing the liver from the formation of factor 2, 7, 9, and 10. It is usually given to prevent the clotting for a long time as in patients with atrial fibrillation. Conditions with excessive bleeding. Number one, vitamin K deficiency. Vitamin K deficiency either due to fat malabsorption or broad-spectrum antibiotics killing the bacteria flora of the large intestine. There is vitamin K deficiency, so inability to form the four clotting factors 2, 7, 9, and 10. Liver disease. As we know, the liver is the major site of the formation of clotting factors. So in chronic liver disease, there is decrease in the formation of the clotting factors. Hemophilia A is a genetic defect causing a deficiency in factor 8, so there is severe bleeding on injury. Thrombocytopenia, a condition where the number of the circulating platelets is deficient. These are the most common causes or condition with excessive bleeding. We will have a look at hemophilia. Hemophilia is a genetic disease transmitted through the chromosome X from the mother, which is a carrier of chromosome X, to half of her sons. So usually the disease appear in male. The disease is appear in male. Why? Because the male is XY. He gets this X from the mother, which carry the gene of hemophilia, and carries the Y from his father. So that is the son who get the disease from the carrier mother. X-linked disease, and it is usually characterized by what? It is usually characterized by the excessive bleeding on trauma. So there is bleeding easily, so should avoid trauma. They have something which is called prolonged clotting time. The time needed to form the blood clot is prolonged. They have easily bruises on minor trauma. So usually there is subcutaneous bruises under the skin, and there is hemoarthrosis, there is bleeding in the joints. Hemoarthrosis, which is a bleeding in the joint. So there is bleeding easily like epistaxis. There is also intracranial hemorrhage may appear during labor. There is intracranial hemorrhage may appear during labor of this baby. That is the hemophilia A, characterized by a genetic defect leading to deficiency of factor 8 anti-hemophilic globulin. It is an X-linked disease transmitted from the mother to half of her sons, characterized by easily bleeding, prolonged clotting time, bruising easily, and hemarthrosis, which is bleeding in joints. The second defect, which is most common, is the thrombocytopenia, either due to decreased production of platelets or increased destruction. So it is mainly caused by deficiency of the platelets, and this is usually manifested by what? By the formation of or appearance of berbera, the subcutaneous bleeding. These points, which is like the flea bites, this point is known as the berbera, is known as berbera. This berbera is a characteristic of thrombocytopenia. It's characteristic of thrombocytopenia. It is characterized by prolonged bleeding time. The time needed to stop injury or stop bleeding by formation of platelet blood. So what is the meaning of bleeding time? It is the time needed to stop bleeding by the formation of platelet blood. So with thrombocytopenia, we have prolonged bleeding time. Again, what is the meaning of bleeding time? It is the time needed to stop bleeding by what? By the platelet blood formation. What is the clotting time? Clotting time is the time needed to stop bleeding by the formation of blood clot. So we have two tests, and these two tests used to detect the efficiency of the hemostasis. Number one, bleeding time. Number two, clotting time. Bleeding time is prolonged in thrombocytopenia, you are right. Clotting time is prolonged in hemophilia, yes. Also in liver disease, yes. Also in vitamin K deficiency. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you very much.